When we're thinking about suicide risk, it's important to balance risk factors and also protective factors, because the more protective factors there are, that also can decrease the amount of risk, even if somebody is having thoughts of self-harm or of suicide. And getting very specific in asking detailed questions and becoming comfortable asking those questions. Within the risk factors, there's often modifiable risk factors. So if somebody is having thoughts of suicide and they do have a plan and they think about, that I would take all of the pills that I have of this certain medication, that's a risk factor that can be removed. That often can bring a lot of comfort to the person themselves. So I think sometimes, it's not as a punitive act, but really how do we help you feel safe? And often there can be a degree of impulsiveness around suicide. And so just slowing that down, where in an impulsive moment, there's not immediate access to something that someone would harm themselves with. And then when we're taking that whole picture, both risk factors and protective factors in balance, then what's the sense of the risk level, whether it's low or medium or high? And so each discussion of a thought of harm is not equal as far as the response that it needs. So I think an important piece too, we're always looking at ourselves within the work. So what are we conveying in having this conversation? And even if we're not quite feeling it internally, trying to really be conscious of slowing down our speech, taking some deep breaths as we're talking, so that we can approach the conversation in sort of a calm and matter-of-fact manner. Because that's just a really scary conversation for your client to have. And if they begin to share, sort of dip their toe in the water of acknowledging that they're having some thoughts of suicide or harming themselves in some way, and then we panic and over respond and send in, sort of raise the alarm bells, I think that can cause a pretty quick retreat, or feel like I better not admit that to somebody else again. And so it doesn't mean that we might not still need some of those safety precautions, but to really try to stay grounded and do it alongside where the client themselves also feels empowered in keeping themselves safe, and how we're all working together around that.